There you go. Kelvin, did you see this as yet another failure of the Home Office and the associated officials in making sure migrants are screened properly?
I do think there's been a massive error here. I mean, after all, I think we had 4,000 in at Manston, and then suddenly once the political storm broke over Manston, that then came down to virtually nobody in there at all. So they all went all over the country. Now, they knew that diphtheria was an issue because diphtheria among migrants in Europe has been on the up. And in fact, the cabinet minister said today that admitted that one migrant had died of diphtheria, but also said that they thought that the numbers would grow by the time they started checking everybody on Monday. So it could be, the number in the Sunday Times says 70, but I think the number that currently is being thought about is 50. Now, this is quite a lot of people. And the other issue is, why wouldn't you test them? After all, we give them food and give them other forms of succour. It's in our interest to find out that if these people are coming to our country and there's something wrong with them, we need to find it out. We don't want to spread it in our community. And so why on earth they would have then simply dispersed everybody without checking? I mean, the last time we saw that in this country was called COVID, when we sent all the old dears back to old folks' homes. And look how that turned out. They were literally, potentially, and with the inquest still really to take place in public, thousands dead. So look, diphtheria is not COVID. I totally agree. But the number that you didn't put up on your bullet point there was that 5 to 10%, by and large, are killed by diphtheria. Now, if for instance we had 70 or 80, and therefore there are eight people dead from diphtheria in our country, I would think that there would be a minor health alarm, not a major one, but definitely a minor one. And this would be really, I do believe, be laid at our door. Now, it's absolutely shocking. I know how most people watching your show right now will be thinking to themselves, that's all we need. Not only do these people come to our country when we don't want them, they come to our country with a disease which can spread. And look, it may not kill any of our people. Let's hope it doesn't. And by and large, let's hope it doesn't kill any of the migrants either. But this is another reason why, honestly, we could honestly do without this. I mean, we have a National Health Service, by the way, which can't even cope basically now. If you've got the flu, they put their hand out and say we want another, 500 million quid in order to defeat flu. So how would they deal with a mass diphtheria outbreak? Look, I do accept that if you're, I think, up to 6 years old, you get the injection anyway. So the chances are very small. But it's another political failure in relation to migration. And I honestly cannot understand this government's lack of thought process to say we must get hold of this issue, no matter what the pain is, what the politics is. We didn't mind when we had COVID. We said we don't care what the cost is. We don't care what we do about it. We're going to have a phenomenal investment to try and stop it. But we don't seem to approach this migration in exactly the same way.
Well, I don't know why.
Frankly, I don't know why.
Well, Kelvin, stay right there. I'm also joined by Dr. Andrew Vallance-Owen. He's a former medical director and chief medical officer for the Bupa Group. So, right, well, let's start with it. I mean, what are the symptoms of this infection? Is it just like a cold? Does it start off quite mildly?
It does, like so many of these things, COVID and other things too. Sore throat, fever, but a very nasty cough, a croup, and you can get a nasty sort of thing growing in the back of your throat, which can sort of block your breathing. So that's very nasty. So that's how it starts, but it can, as you've just heard, get much more serious and affect the heart and the kidneys, and 5 to 10% of people may die with it. So it can be very serious and has to be treated seriously.
Now, in your view, do you support compulsory vaccines and treatment to deal with this issue? Because I know my son's had them. I think they're compulsory for everybody here in this country. Do you support the notion that they should be compulsory?
Oh, certainly. One of the reasons why it's very unlikely, as Kelvin's just said, that people in this country, citizens of this country, will be affected by it is because the vast majority are vaccinated at 8 weeks, 12 weeks and 16 weeks in this country. So the danger is more to the immigrant population.
So you'd say that so there's not really much of a risk to us in this country initially, but can't you end up with something that sort of slightly mutates and becomes vaccine resistant, and then you end up having to deal with the next thing, a bit like the way the COVID sort of has moved on and started to change. Once you get lots of it in
bacteria, it doesn't mutate like viruses do. Okay. So it's and we've had it we've been on the case for years and years and years. But just coming back to the point, I do think that people who are looking after these immigrants and who have contact with them should at least be offered the booster vaccine, and that is being suggested because they could possibly pick it up. So that is the only place where I think British people, if you like, might be affected. But certainly, and I do agree with Kelvin here, I think there should be compulsory screening of people coming into this country in this way so that we know what we're dealing with. It should be recorded. And if they are being sent to other centres, the people where they arrive at those centres should know what they're dealing with.
But then we have but then this is the body autonomy sort of argument then that, you know, because then you've got all what happened with COVID, people saying body autonomy, we should be able to choose whatever we do. Do you think that argument will hold as well, though, because they've come to this country? Should that almost be a condition of entry? So then we are heading towards mandatory vaccination territory.
Well, I was talking about screening, of course, which is a slightly different thing. It's an investigation, and I think it's perfectly reasonable if there's a problem, just as when COVID was on, many countries were checking before people came into the country that they were negative. And I do think screening is something which public health people have the right to do, I think, to ensure, to know what's going on and what's coming into the country. I think vaccination is a more difficult one. We've tried not to be compulsory, but I do think if anyone's had contact with or has the symptoms, that they should be strongly offered vaccination, but also with diphtheria, you normally start antibiotics at the same time because that can help you head off the worst effects of it.